happy Wednesday morning, December 9, 2020. I'm Riley King, and welcome to this Wednesday morning edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Wednesday morning, but first we're going to begin with COVID-19 updates. 807 new COVID-19 cases reported in New Hampshire. No additional deaths. There have been 26,623 known coronavirus cases since the beginning of the pandemic in New Hampshire. Let's take a listen to that video from WMUR News 9.
Well, winter's here. So Mahindra, the official tractor of tough, doesn't slow down.
Revised numbers from the state show that there were 2 days last week with more than 800 new cases of COVID-19. Good evening, everyone. I'm Tom Griffith. This is a look at the latest numbers from DHHS today, reporting 807 new cases, some dating back to last Thursday. The state says it's still processing tests for these days, so they could go even higher. The new cases announced in December make up more than 27% of the total cases confirmed in New Hampshire so far. Active cases have hit a new record. There are more than 5,500 people with the virus right now. There are no new deaths to report.
Okay, and there you go on that video and that report. And now let's take a look at New Hampshire COVID information, new updates and data. Let's take a look at that right now. And here is a look at that information for all of you. Right now, there are 26,623 number of people in New Hampshire have tested positive for COVID-19. 15,137,712 number of people in the United States have tested positive. 566 number of deaths from COVID-19 in New Hampshire. 849 number of people have been hospitalized with COVID-19 in New Hampshire. And 880 number of deaths from COVID-19 in the United States. Let's take a look at this map of New Hampshire where current cases of COVID-19 are. Manchester, 876. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Manchester, 4691. Now let's take a look at the three charts here. Let's start with the first chart here. New cases each day in New Hampshire in the purple. Daily new positive COVID-19 cases. In the orange, new hospitalization and red deaths. Now let's take a look at this chart here. Current cases in the purple. Total current COVID-19 cases. In orange, current hospitalization. Let's take a look at this chart here. Total cases in the purple. Total positive COVID-19 cases. Orange, total hospitalization. Red deaths and blue recovered. Let's take a look at this chart here. Positive PCR test rate and daily PCR test. Let's take a look at this chart here. Age group of cases, female and male of cases, and risk information. Let's take a look at this chart here. Infections, hospitalizations, and deaths. Let's take a look at this chart here. Deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, your common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. Hospitals may have to deploy surge plans to increase capacity as COVID-19 cases rise. State sees highest level of positivity since May. Let's take a listen to that video from WMUR News 9, Amy Cavino.
we're on is concerning. The rate of rise that we're seeing in hospitalizations in Manchester specifically is a challenge.
Right now, New Hampshire is seeing the highest level of positivity since the first wave of the pandemic in May. At the Elliott Hospital, 45 patients are admitted being treated for coronavirus. 6 are in the ICU. 1 is on a ventilator. At St. Joe's in Nashua, they have 208 beds. Right now, 104 of them are filled. 17 are patients with COVID-19. 5 are in the ICU.
I think many of our hospitals are feeling the strain. Many of our hospitals are dealing with staffing shortages.
Dr. Baxter says New Hampshire hospitals cooperate and support each other, but surge planning is definitely a daily discussion now.
I think cooperating together, we can extend that timeline, right, and hopefully let this surge begin to flatten out a little bit.
Beyond the number of beds, hospitals are struggling with staffing. Overtime is a must.
We're lucky to have a very resilient staff who is looking to, serve as best they can. The challenge is they're not immune from COVID.
The duration of hospital stays is a few days shorter now than at the start of the pandemic. Dr. Baxter says that's because fewer patients are requiring the ICU, which is a relief because ICU beds are limited.
Okay, and there you go on that video and that report. National Guard training to fill staffing vacancies at New Hampshire State Prison due to COVID-19. Prison reporting positive case in residents and staff. Let's take a listen to that video from WMUR News 9, Jessica Moran.
Just staying calm and focused, using the tools and skills that we've been learning and practicing and engaging in.
The New Hampshire Department of Corrections is reporting today 28 active cases of COVID-19 among prisoners, and on Monday they reported 27 staff members with active cases.
This has not been something we ever thought we would be immune to.
With cases inside the prison rising, they're calling in the National Guard. The commissioner says they're training on how to work in the correctional environment, and they will be helping, but they will not provide direct supervision of the prisoners.
We want to be very careful that we reserve the direct resident work to our certified corrections officers and use the National Guard service members in a way that's effective and will have positive outcomes for all of us.
News 9 heard concerns from family members and friends of the prisoners about how the prison is handling the rise in cases. The commissioner says they're following COVID-19 guidelines and they quarantine residents and close contacts of those who test positive.
We have engaged in appropriate, pursuant to New Hampshire Public Health and CDC guidelines, in quarantining specific housing units associated with contact tracing.
The commissioner says when a resident is moved to a housing unit or quarantine, they take their contaminated clothing, ask them to bathe and clean, and provide them with fresh items.
Clean bed, clean linens, clean clothes. We have a whole procedure in place. It's being monitored. All of those things. We have contemplated them and engaged them.
The commissioner says they're further along than most correctional institutions, and they'll continue to give COVID-19 the respect it deserves. In Concord, Jessica Moran, WMUR News 9.
Okay, and there you go on that video and that report. North Conway Hospital shifts COVID-19 testing site off the hospital location and increased demand. Drop in COVID-19 testing at hospital's emergency department is no longer offered. Let's take a listen to that video from WMUR News 9, Andy Hirschberger.
Snow piles up quickly. Remove it just as quickly with Kubota subcompact and compact tractors. Our #1 selling.
Memorial Hospital in North Conway will no longer be offering drop-in COVID-19 testing at their emergency department. Starting Thursday, anyone who wants just the test and not to be seen by a physician will be directed to their nearby coronavirus testing center.
The goal is to free up the emergency room staff to be able to take care of emergency department patients. Continue to test everyone who needs to be tested. There will be a screening process in the testing center for patients who are symptomatic.
Will Owens says in early November they were testing about 60 to 70 people per day for COVID-19, with symptomatic cases being done in the emergency room and asymptomatic cases in the testing center. But by the beginning of December, those daily testing numbers more than doubled, putting a strain on the emergency department.
One example is we had 45 plus cars roughly show up in the emergency department in a short period of time, all looking just to be tested, did not want to go in and actually be seen by a provider.
Owens says while they only have one hospitalization, they're preparing for the future.
With Christmas and New Year's coming, us being a destination resort for skiing, ski areas, getting the weather to finally blow snow, we're going to see more people coming. And so, yeah, there is absolutely a concern, and we're preparing and watching closely.
Owens says the test results can take up to 72 hours, but most are back the same day. Reporting live, Mandy Hirschberger, WMUR News 9.
Okay, and there you go on that video and that report. Hampton community rallies hold Spirit for long-term care facility aimed COVID-19 outbreak. Donations, gift cards donated by the community. Let's take a listen to that video from WMUR News 9, Jennifer Crompton.
Chapel Tractor has been in our family since 1955, when great-grandfather Pearlie and our grandfather George decided to sell tractors.
Living or working in a long-term care facility during a COVID-19 outbreak, described as like being on an island. The Oceanside Center in Hampton, like many others across the state, understands all too well.
The holidays have been isolating for our residents, and even before our outbreak, it was isolating because we had to restrict visitation.
The community letting them know they are not alone.
When you're filling out your Christmas cards this year, fill out a Christmas card to a resident here, fill out another one for the staff here, 2 Christmas cards, and then we want you to challenge your friends and family.
There's a holiday card challenge.
So I shared it to the Experience Hampton page and a couple of Facebook groups locally in town, and it took off like wildfire.
And a gift card challenge for Oceanside staff.
I've already collected almost 100. And it's just a small token of the appreciation in this town.
There's a business owner making sure every door inside has a wreath and every resident a gift. And when the town found out the company hired to decorate the outdoor tree was a no-show.
And we have a ladder truck coming. We have people just donating. We have tons of decorations for it. People just dropping them off at the door.
Some outdoor areas to be decorated too, so the people inside can see them looking out.
We just want to show them some love. Show them that people still care about them. People care about the staff, but they also care about the residents in there.
I think it really brings the community together and spreads some of that Christmas spirit.
In Hampton, Jennifer Crompton, WMUR News 9.
Okay, and there you go on that video and that report. New Hampshire towns along the Massachusetts border see increase in COVID-19 positivity rate. Towns see positivity rate above 15%. Let's take a listen to that video from WMUR News 9, Tim Callery.
Well, winter's here. So what? Mahindra, the official tractor of tough, doesn't slow.
Well, Tom, as we've seen across the state, the Thanksgiving holiday has really pushed up numbers in the southern end. But doctors in that area say their proximity to the Bay State is also playing a role.
Everything from retail to business, schools, that is where COVID lives.
And with more people moving indoors, we can expect COVID-19 cases to continue to rise, says Dr. Neil Meehan, Chief Physician Executive of Exeter Health Resources.
The fact that we have people in congregate areas like cities and towns of that nature it's bound to happen.
Rockingham County has been hit hard by the pandemic compared to other New Hampshire counties.
You see the seacoast as the populous areas, and we're also right next to Massachusetts, another metropolis that we're being affected by.
Kensington tops the list of towns in that area with the highest positivity rates over the last 7 days. Right now, they are sitting at 30%. Plastow also has a high positivity rate with 18%. That town has seen 1 new case per 94 residents in the last 2 weeks. The jump in the numbers also spreads to the south central area. Londonderry has a 16% positivity rate. Windham has reported 1 new case per every 110 residents.
We still haven't seen the peak from Thanksgiving. We're going to have to deal with Christmas and New Year's and peaks after that. It's going to be interesting to see how we do come January.
We're your last stop, but the front line is in the community, and that's where we need to be the most safe.
So as for testing, well, doctors say right now the state is doing okay, but that could change as more people contract the virus. Reporting live tonight, I'm Tim Callery, WMUR News.
Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast, right here on the Riley King Network. Thank you for watching. Have a great rest of your day, and I'll see you back here later on today for another newscast. I'll have a news report coming up in a little bit. Goodbye, everyone.